Good afternoon and welcome to the UCR School of Public Policy's special online event, the 2020 election and its implications. My name is Justine Ross and I am the Associate Director of the Blum Initiative and of the Presley Center, both research centers housed within the UCR School of Public Policy, and I'll be moderating today's event. Before I introduce our panelists, I'd like to provide a general roadmap for today. For the first hour, we're going to have a fast-paced conversation across our panelists on topics like COVID-19, economic inequality, immigration, housing, and other issues that were really central to the 2020 election. Each panelist will be given roughly 2 minutes to answer each question that they're posed, and if all goes according to plan, we should have a little bit of time at the end of each section to have some crosstalk and hopefully some lively debate across our speakers. During the final half hour, we'll take questions from the audience. Please use the Q&A feature, which you can find at the bottom of your screen, not the chat feature, to submit your questions throughout the event. We encourage you to submit questions as they come to you. We certainly don't want you to forget something from earlier on in the event. So just again, please use that Q&A feature and keep the questions coming. We'll get to them in the last half hour. So moving to our panelists, we've assembled a really diverse group of experts who reflect the School of Public Policy's commitment to interdisciplinary research and practice in its faculty, research centers, and students, as you'll see in a second. Each of these panelists have multiple areas that they could speak to and are subject areas in multiple policy areas. But we're asking them primarily to stick to one specialty for this event so we can ensure that we remain on topic. So with that said, going through, I'll introduce each panelist. They'll say a quick hello so you can put the name to the face and we'll go from there. So starting with Dr. David Brady.
Good to have you here, everyone.
There we go. Dr. Brady is a professor of public policy and director of the Blum Initiative on Global and Regional Poverty, a research center within the School of Public Policy. His research investigates a variety of questions related to poverty and inequality, political economy, social policy, and labor. And today he's really just going to be speaking to issues of income inequality and poverty. Next up alphabetically is Dr. Richard Carpiano.
Hi, thanks for having me.
Great. Dr. Carpiano is a professor of public policy and of sociology. As a medical sociologist and population health scientist, his research broadly investigates how social factors like socioeconomic status and race and ethnicity contribute to physical and mental health. So today he's speaking in his capacity as an expert on public health. Kristen Kopko.
Hi, thank you for having me.
Of course. Kristen is a project policy analyst for the Inland Center for Sustainable Development, ICSD. ICSD is a research center within the School of Public Policy that conducts research on issues of suburban growth and the interconnection between social well-being, the economy, and environmental sustainability. So today, Kristen lends her voice on issues of housing and on the region's response to the COVID-19 pandemic. Dr. Ramakrishnan.
Hi, everyone.
There we go. Dr. Ramakrishnan is a professor of public policy and political science and is the director of the Center for Social Innovation, yet another research center within the school. He's well published in the areas of racial identity politics, immigration, and on issues of federalism, and is a frequent media contributor on these topics. Today, he will be speaking in his capacity as a racial equity and community development expert. And lastly, we have Lorena Rosas Garcia.
Hi, everyone.
Thank you, Lorena. Lorena is a Master's of Public Policy student here at UCR. She also works with the UC Immigrant Legal Services Center to assist with renewals for DACA students attending all of the 5 UCs in Southern California. So Lorena is here to lend her perspective both on immigration policy, but also to speak in her capacity as a student at UCR. And for those of you who are familiar with how the School of Public Policy does business, it should come as no surprise that we have a student on this panel because we really like to hook you all in early and sort of throw you into the deep end of policy to learn. So thank you to all of our panelists and to Lorena, obviously, for joining us. So if you want to learn more about any of our panelists or the research centers that we've referenced, please visit spp.ucr.edu. And assuming that there are no issues among our speakers, we're going to jump straight in. and really begin by addressing the elephant in the room, which is the transition after the election. So this is the one time that we're going to be asking our speakers to sort of look back at the election and to look at what is currently going on politically. We want to make sure that the rest of the panel is really focused more on policy and what the future could look like, what it might look like based on what we know. But that said, there's a lot of media attention surrounding the transition, and we want to provide a space, to get it out of your system. So to each of the panelists, we'll go alphabetically, but with the election called for President-elect Joe Biden, President Trump has signaled an unwillingness to cooperate in the transition of power as we've understood it to this point. So I want you to think about how might this delay impact policy in each of your respective policy areas. Do you anticipate that this delay will hamper a Biden-Harris administration's ability to effectively govern on day one? Roughly 1.5 minutes each, starting with Professor Brady.
Sure. Yeah, the answer is absolutely yes. And it's most transparently and obviously because of the slow implementation of changes regarding COVID. This is the inescapable crisis in front of us. Until we get rolling on this, get this under control, everything else is going to get frozen. We're up to 150,000 cases a day here in the United States. So this is, it's very clear that the delay will be very bad. It will certainly hinder our ability to tackle COVID. And because of it, thousands of people will die. It's that simple. I'd add to that it's really troubling to see this slow transition of power for just our democracy. And so I'm very, very troubled by that. And I think that's equally troubling.
Thank you. Professor Carpiano, your thoughts?
Sure. David Brady took a little bit of my line, but that's something that's hitting everybody these days. Absolutely, and particularly from a public health standpoint. Given with the case rises that we're seeing right now, action's absolutely needed, and we're not getting it. And so really to take some sort of responsive action can't come soon enough. And so anything that's going to be delaying that is going to be important and being very critical, particularly given to the extent to which the Centers for Disease Control has really been undermined during the pandemic as being our federal source for public health direction and guidance to state and local public health departments. So in order for some sort of coordinated approach to dealing with the pandemic, it's going to be absolutely essential that basically we rebuild our institutions and start to direct money towards state and local authorities that essentially have been underfunded for many years now, and that the pandemic has really forced us to forced us to confront.
Kristen?
So I think that I have to echo my other panelists that it will definitely delay the implementation of new policies on day one. Hopefully that will be alleviated as time goes on, but obviously now housing is going to take a backseat anyway to COVID, which is completely understandable. So I think that it will definitely delay, but I'm optimistic that as time goes on, we will get some really great new policies.
Professor Ramakrishnan?
I don't want to just repeat everything that's been said, but I would say that, on top of this kind of transition delay, we can expect to see gridlock, unless those two Georgia special races go Democrat. Unfortunately, what we've seen is a perfect willingness, especially, and I say this not as partisan. In fact, I'm no party preference in California, have been since 2002. Just the kind of game of chicken that is played, with many of decisions, that surrounding budget and other matters that I think affect vulnerable communities, that affect historically marginalized communities, is something we should all be concerned about. Some of this talk about not giving first of all, you saw not giving a president the benefit of informed consent with the Supreme Court justice nomination with Merrick Garland in 2016. Now there is talk about scrutinizing cabinet appointments based on their positioning. I mean, we have already headed into uncharted territory, at least in terms of the history of the modern bureaucratic state in the United States. And it seems like some folks are perfectly willing to accelerate that process. I actually found quite troubling some remarks by Supreme Court Justice Sam Alito recently that was covered, warning of rule by experts, and to say that it's really troubling to see the kinds of restrictions on COVID that can be imposed on communities of faith, not understanding that we have a longstanding tradition of giving government deference to protect public health and the public good. So for me, this transition stuff is just tip of the iceberg of what we're going to continue to expect in the coming weeks and months.
Thank you. Lorena, last but not least.
Yeah, I echo with everyone else. Of course, there's going to be a delay, especially when it comes to immigration policies. Immigration is always the last priority on the agenda, and it was one of the ones that was hit the most. So it's going to be the last to see change, and it's going to be pushing back as far as waiting for anything to be reversed.
Right. Thank you all. So jumping really into the more substantive, not that that isn't substantive, but what is meant to be the focus of our panel today, we want to jump right into the topic that really has dominated our lives and the news cycle since March, COVID-19, focusing both on the health and economic effects. These questions will go to Professors Carpiano, Brady, and Ramakrishnan, and to Kristen, roughly 2 minutes each. And then we want to reserve some time at the end for there to be discussion across the panel, because this is, as I said, an area obviously that has really monopolized our time and attention as of late. So starting with Professor Carpiano as our public health expert kicking us off, President-elect Biden has identified COVID-19 response as an immediate priority of his administration. In addition to increasing diagnostic testing ability, ensuring access to PPE, developing an effective vaccine delivery system, he's outlined support for a national mask mandate. So our question to you is, do you think the Biden-Harris plan does enough from a public health perspective, and how realistic is implementation?
Well, I'm going to take the second part of that question first. And well, just to say with a caveat, it's fantastic to actually see a plan being put out, given that we've seen really some very scattershot types of policy approaches. You could almost say, I mean, I would, and and like Karthick, I myself a no party preference voter. Really a small piece sort of policy of what we've seen so far in terms of pandemic response, very scattershot. So it's very nice to start to see expertise being brought to the table, the role of science again, and really being pushing that. In terms of the realities of its implementation, there's going to be some real challenges ahead, just given to the extent to which the COVID response has been so politicized, and essentially the sort of the response well has been poisoned, so to say. And so things like being able to talk about mask mandates, national mask mandates, and other sorts of efforts from government. At this point, we know we're going to see some very significant pushback, building a lot of actually on some things that Karthick had raised earlier. One big element that I think though is missing from the plan, or needs more detail, particularly as in light of this week's news about the vaccine being potentially being forthcoming, we still don't know. That data is very preliminary, and we should be very cautious about it, is the role of communication. We've talked a lot about Operation Warp Speed, and to its credit, it has sped up the development of a vaccine. But at the same time, even as members of that project or that initiative have stated, they're still very concerned about the fact of that if you build it, basically, that no one will come. And we know from polls, and we see declining willingness to get the vaccine. And this is really quite a concern, because there has not really been much of a focus about communication. We hear a lot about effectiveness, not a lot about safety, and public buy-in is going to be essential for this. And so really the plan really needs to be able to also take into account communication and education types of strategies in coordination with the drug companies, which have not done a very good job of this, really, appearing on news pieces along with discussing stock prices. Those are not the things that you build up public confidence in about a new innovation that could, bring us back to some semblance of life pre-COVID. So to me, that's going to be one of the big elements. And broader with this, I do like to see this plan as a nice sort of leaping point for what I hope to see going forward, is really just a pushback against you could say an epidemic all into itself of disinformation, not just through elected officials pushing things for their own sort of political sorts of purposes, but even more broadly of what we see sort of with in terms of online disinformation and how that's really really problematized response to the pandemic since the early days of this, when we were really going into sheltering in place. I mean, in some ways, misinformation started almost probably as fast as the virus was spreading globally.
Great. I'm sure we'll come back to much of that when we sort of have that crosstalk at the end. Redirecting briefly to Professor Brady. So the few remaining benefits of the original COVID relief bill are set to expire at the end of the year. Not to sort of go doom and gloom, but it's estimated that an additional 8 million Americans have fallen into poverty since May. October's unemployment rate fell to 6.9%, but it's still twice what it was in February. And in September, roughly 80% of those who have left the workforce because they're no longer looking for a job are women. While both political parties agree that it's a necessity to pass a second COVID relief bill, there's no agreement as to what the specifics are. And so there's no movement or progress in that area. Can you speak a bit to the impact of interventions like the original COVID relief bill, the CARES Act, on preventing poverty and exacerbating issues of inequality more broadly?
Sure. We can summarize pretty clearly what the COVID relief bill did, and it worked. It was very effective. It reduced poverty. It got economic resources to people that needed it. There's no evidence that it discourages work. And I would even say it's essential. We need another bill like that. And so we need some sort of massive stimulus bill that probably involves unconditional cash benefits to some huge share of the US population, maybe the bottom 2/3 of the distribution. I know it's going to be very, very difficult to get this, but we also need bailouts to the states. This is a gigantic economic crisis because of COVID, and there's just no way around it. I would say that the only we're going to be able to pay for this is to increase taxes on wealthy people, like several of us on this panel, and that's inescapable. And it's interesting, like with Rich, I completely agree. We want to depoliticize the public health response to COVID, but on the case of budgets, taxes, economic stimulus, it's so transparently politicized, right? Like it's inescapable. And in that sense, we're going to have, a ruthless political struggle to get some sort of stimulus going. It's going to be a fight to get anything from Congress. And the Biden administration should just try to get as much as it can. But it's certainly going to be politicized. It's inescapably politicized. I would argue for as big of a stimulus as possible with tax increases on affluent people and unconditional cash benefits to large shares of the US population.
Great, thank you so much. Professor Ramakrishnan, in a similar vein, racial and ethnic minorities have been disproportionately affected by the coronavirus, both with respect to their health outcomes and to their employment. President-elect Biden appointed a healthcare equity expert to his coronavirus task force, which I think optimistically signaled that his administration is minimally cognizant of this inequity and will likely or hopefully make it a priority in response moving forward. Can you tell us a little bit about racial disparities in this context and what sorts of actions you think are necessary or would like to see taken by a Biden-Harris administration to work toward a remedy?
Thank you. Yeah, I mean, this is a big question. First of all, from what I've seen, so not only am I director of the Center for Social Innovation, I run a project that's been around for about 7 years called the API Data. And what we saw was an interesting kind of difference in terms of whether or not Asian Americans are disproportionately affected by COVID. So if you look at the cause of death data, it doesn't seem like they're disproportionately more likely to be affected. But if you look at the disproportional death data, right, essentially in a particular geography, if you look at the death rate in a particular week and compare it to the 5-year average for that same week in that geography, it does look like the Asian death rate is significantly higher. So there are different potential reasons why that might be the case. One of the reasons that a lot of community partners suspect is that when we see with prior pandemics, when you have populations that have been stigmatized, so if you think about the gay population in the early 80s, if you have a population that's stigmatized, they're less likely to seek care. And so the consequences of delay in care is significantly higher. And so so first of all, the difference between having a president that uses some really awful race baiting to actually racist language to describe the virus to someone who speaks about it in a race neutral way is going to make a world of difference to some of these communities in terms of what is being talked about. We should also recognize that when it comes to communities of color, including Black and Latinx communities, as well as Pacific Islander communities, our essential worker population. I mean, that's where a lot of this comes to workplace safety and the relative lack of power that many of these employees have in terms of their exposure to harm. And so that's going to be important to see, so it's not just about Health and Human Services kind of response. It's also Department of Labor response, occupational safety response. California is doing a lot in that vein. Someone like Labor Secretary Julie Su is mentioned as among the short list of people that are being considered for labor. But those are the kinds of things that are going to be important to make sure that that this disease does not disproportionately affect low-income workers and communities of color.
Thank you. And sort of in that vein of response, Kristen, I want to ask you, your center, the Inland Center for Sustainable Development, focuses on a myriad, obviously, of connected issues like well-being in the economy as relates to suburban growth. And so given sort of your specialty in the region, can you tell us a little bit about what our region's response to COVID-19 has been thus far? And more specifically, kind of what have they used their CARES Act funding for?
Sure. So the combined two-county region has allocated over $800 million of CARES Act funding into local programs. And those programs include general pandemic preparedness, housing payment assistance, and also business loans. And the most well-funded portion of this is the general preparedness portion. And that goes to anything from contact tracing to personal protective equipment. And the County of Riverside has allocated over $310 million in funding for those sorts of programs. And the rental and business loans obviously are a little less well-funded, but they're very impactful. The housing assistance programs include things like mortgage or rental payment assistance, which essentially is keeping people in their housing who have maybe lost their jobs. And the city of Riverside alone has allocated over $10 million to help with this and homelessness during the pandemic. And this is really important because, our center, we focus on local issues, and we put out a report, and the rates of missing payment for renters and homeowners has very much increased during the pandemic compared to what it was 2 years ago. And so housing is not an isolated issue, and something that's very important in keeping people in their homes is it's, where you go to work. It's if you can get to work. It's education sustainability. And so keeping people in their homes is very important. And the last thing I want to talk about was the business loans that are mainly used for payroll protection. And for example, San Bernardino County estimated that the payroll protection has kept over 100,000 people in their county in their jobs so far. So the CARES Act funding has been really important and really impactful for the inland economy specifically.
Great, thank you. So I'd like to open it up now to the entire panel. If there's anything that, your colleague said that you want to respond to, an area that you'd like to elaborate, certainly if nobody pipes up, I'd like to hear more from Professor Carpiano, since I know you've been very active in discussing both sort of nationally and regionally what the dynamic has been. But I'll leave you to it unless you guys need some prompting. I'd love to hear from all of you.
Well, I have something I'll just jump in on the CARES Act funding. Now, those double-digit millions of dollars look great, but let's understand that these are hundreds of millions of dollars that were allocated to both of these counties. And more generally, in many counties in California, you don't have the kind of transparency that we typically have on regular kinds of budget allocations. So I'm hopeful that moving forward, it's, if we're talking about our most vulnerable communities that are supposed to receive assistance through the CARES Act, that we have greater budget transparency and community engagement when it comes to deciding how these dollars should be spent. Fortunately, it's been slow progress on that. I'm hoping that we can make faster progress. On the matter of pandemic response, I'll just say a little bit and maybe toss it over to Professor Carpiano here. We just did a survey of Southern California residents, and what we find is that the vast majority of residents prefer prioritizing public health, even if it means that the economy will suffer to some extent, than the other way around, prioritizing opening the economy if it puts public health at risk. Unfortunately, the loudest voices in the room, especially in the Riverside County Board of Supervisor meetings, are not those that share that view. And I'm hopeful that not only are we doing things that follow the science, but if these elected officials say that they care about the opinion of their constituents, they should be listening to all of their constituents and not just those that can pack council chambers.
Can I just really quickly to follow up, Professor Ramakrishnan, when you're talking about having greater community engagement and future budget allocations for, fingers crossed, soon to be a second COVID relief package, what does that look like from your perspective as somebody who does a lot of sort of this community engagement work?
Well, so it means that first of all, transparency always helps, so that you don't need to have insider knowledge in terms of what the monies can be used for, et cetera. But beyond transparency, you have to actively go and reach out to community. You can't expect simply through a public comment. Public comment process is actually an indication of lack of engagement. So you need to be very proactive and go to the communities where they are. There are tools you can do, participatory budgeting, for example. You could, even if you don't want to go that far, just making sure that people understand what the options are and to do that work of listening. One of the things, unfortunately, is that even though many of us, especially in the wake of the killings of Breonna Taylor, George Floyd, and others, there's a commitment to racial equity. We've had both counties pass resolutions saying that racism is a public health crisis. But if they truly believe that, they have to engage communities and their resident expertise, right? It cannot simply be that the people who are most expert in terms of how budgets should be allocated are those within government agencies or those with the kinds of significant dollars to hire lobbyists and public affairs officials.
Great, thank you. Other responses on COVID-19 health or economic effects?
Yeah, I mean, I think some of what we heard is pretty good argument for just unconditional cash transfers to people. We can talk a lot about curbing evictions, but an easier way is just to give people money to pay their rent. And similarly, if there's concern about the public accounting of where the money's going, and there's been legitimate concerns about these, the employer supports not really going to the people, just bypass the employers. So I think, we see a pretty clear case for, sort of unconditional distribution of cash transfers would be by far the most effective strategy. And it's just a good example of how universal social policies are good because they don't have all these administrative burdens and bureaucratic hurdles that we put in the way of people. Just give people money and trust they're going to spend the money more efficiently and more quickly than we would through any other mechanism.
Right,
I like that. That would be great to see. I don't know if any jurisdiction's done that.
Dave, we did that, right? I mean, the CARES Act had the, cutting people checks.
Oh, right, from the federal government directly. But I don't know if we've seen counties.
That's the most efficient, and we should just assume we have to pay people to stay home. I mean, as much as I completely embrace Rich's view about strong public health intervention, I can also sympathize with working people that just need to pay the bills and they feel like they've got to go to their jobs. So you just pay people to stay home. And there's really no way around this. And I mean, if these numbers keep spiking like they've been spiking, it's going to get really, really bad. Well, it already is really, really bad. It's just going to get dramatically worse. We got to pay people. And I think, if you can bypass employers and you can bypass local governments, all the better.
Exactly. I mean, oh, sorry, Justine, do we need to move on? Oh, because I just wanted to add in here too. I think the problem is also too where the public debate has been wrongfully put into this black and white situation of whether, you're either pro economy or you're pro public health. And the fact of the matter is, and I think what this dialogue nicely brings up is, anybody who's serious about public health is also being very serious about the economic issues, and vice versa. That's really where we have to think about the fine line to be drawn with this. People have livelihoods and they have to be able to put food on the table and survive at the same time. So nobody is who's serious is making the argument that we should be just sort of locking ourselves up forever and hope and wait that we'll be saved by Pfizer or whatever other pharmaceutical, Moderna or whoever comes along with some magic cure. So in a sense that it's become a bit of a disingenuous talking point.
Great. Not great that it's become a disingenuous talking point, but great sort of discussion thereafter the original responses. So we're going to pivot just, sort of to an ancillary topic here. Healthcare was a tremendous talking point even pre-COVID during the election. And these questions will be first directed toward Professors Carpiano and Brady. And this is sort of, we're diverting from our original plan where I'd like for both of you guys to sort of have a dialogue about this, partially because I've been sort of privy to seeing this in the hallways back when we were allowed to be in hallways together.
Mm-hmm.
But that said, sort of earlier this week, the Affordable Care Act was once again challenged before the Supreme Court. The issue of severability was raised because of the mandate having been struck down. President-elect Biden has proposed expanding the Affordable Care Act by creating a public option and lowering Medicare eligibility age to 60 years. But he's stopped short of supporting a single-payer Medicare for all system, much to the chagrin of some of his Democratic colleagues and some of his Democratic, especially does the Biden-Harris administration's proposed healthcare policy go far enough in both protecting access to and quality of healthcare in the U.S.? And what would you say to those who think that the president-elect's proposal either goes too far or doesn't go far enough?
Rich, you want to go first?
Sure, thanks. Yeah, I'd say as a start, just as more of a, I guess, an historical starting point is, I don't think we really ever gave Obamacare a chance, really. It was rolled out. Obviously, with most policies, nothing is going to be perfect upon rollout. It needed to be tweaked. It needed to be evaluated. There were going to be some issues to deal with it, but it's been sort of picked at ever since. And then along comes dialogue about Medicare for all, in terms of the election, and other sorts of plans that came along on the table too. That now that we're debating. So in a sense, it is, I guess, nice to see that we've got the Obamacare sort of, I guess, Plan 2.0 sort of approach being brought out, and to any extent that it's going to extend access, it's going to extend care. And given the evidence that we've seen, some earlier evidence that we saw from different states seems to have been effective in many sorts of domains. This is a good thing. Now, to the extent to which does it go far enough could there be something better? That starts to get down, to me at least, to the issue of pragmatic politics and the times that we live in. I think, getting back, I'm going to keep hammering, I guess, on this cliche, but to the extent to which universal programs, there's been sort of a poisoning of the well that this could be something that's sort of socialist, and anything that's socialist is bad. It's going to be harder to get some different sorts of political buy-in for something that's going to be much more universal, unfortunately, even if it turns out to be, in terms of any sort of sober analysis, maybe a better, a more cost-effective or ethically speaking, a better plan for America's healthcare. And so realistically, in terms of that's still that part's up, of course, up for debate. But to the extent to which, given the current political scenario that's coming ahead of us in January, waiting to see, I guess, with in terms of with the Georgia runoff election, this is I think this is an important first step, and I think it's a very pragmatic type of step. But as with anything, there's always going to be critics, and frankly, from a Democratic Party standpoint, it's a big tent, and there's lots of different viewpoints, and particularly the progressive side of the party is one that is a very vocal one, and that has to be is going to be wanting to be accommodated and push for certain perspectives too. And so the party is always kind of dealing with those sorts of balancing of different viewpoints within the diversity of the party.
Yeah, I concur with Rich for the most part. I mean, I think I would make a couple points. One is that we lose track of how big of a success Obamacare was. I mean, this was a huge social policy success, at least since the 1960s. I think it's true to say this was the most effective anti-inequality, anti-poverty policy we've had since the 1960s. So it was a huge success. Tens of millions of people got health insurance. The sort of backdoor cleverness of Obamacare was not just, there was two elements. One was the expansion of Medicaid, which was a massive public investment in public health in the states that opted into that, but also Obamacare required higher taxes. So we're charging people more at the top of the income distribution to pay for resources that go disproportionately to the bottom half of the distribution. So that was all good. I do support a single payer system, but I agree with Rich, this is never going to happen politically. So I sort of applaud the political mobilization for Medicare for all. I think it's terrific. I think that the part of the Democratic Party pushing for that should keep pushing. They should keep demanding. And so they should push and push and push for fight for big reforms, but celebrate incremental reforms. So this is, it's like a football match where you're pushing the ball down the field very, very slowly. And I would just point to the fact that every rich democracy that has anything like a rational healthcare system, unlike the United States, they did so incrementally. I mean, nobody except maybe the UK through the beverage plan got a really radical reform right after World War II. Everybody else has just pushed it forward until you get closer to universal coverage. So I'm delighted with the Biden administration, even though I'm also delighted with people pushing and clamoring for Medicare for all. They're not going to get that. We're probably not even going to get the two key components of the Biden administration plans, which is to have the public option. People forget that failed politically during Obamacare. So I'm not super optimistic that we'll get through, but I think the Biden administration can push to shore up Medicare, shore up Medicaid, anything you can do to push coverage at the margins, getting more people into Medicare, more people into Medicaid, pushing for a public option. All of this is good. And it's just going to be a game of inches. You're just going to incrementally push towards more and more universal coverage. And those are wins. And we do need that part of the Democratic Party fighting for Medicare for all to keep the pressure on Biden, but also the Republicans to expand coverage.
So I'm going to take back what I said about having some time at the end to go back and forth. This is something that I think we can circle back to during the Q&A with the full group to talk about healthcare more extensively, because I do want to make sure that we get to the next topic, immigration, and that we have some room for response there, because I know a couple people on this panel have expertise in this area. So this next question, again, moving on to immigration, is for Lorena. Lorena, President-elect Biden has signaled that his administration will move to fully restore the protections against deportation included as part of the Obama era Deferred Action for Childhood Arrivals, or DACA. And he's also signaled that he's going to place a 100-day freeze on deportations to allow time for his administration to develop new guidance. So as somebody who works with the UC Immigrant Legal Services Center, do you anticipate that these changes are enough? Would you or your colleagues say that these are enough? And what else? What other immigration reforms are you looking to, or looking for rather, from the incoming administration? 3 minutes.
Okay, I'll try not to take as much time. Well, to start off, these changes, they're a start, but it's not enough. Restoring DACA and advanced parole will be a start to reversing part of the damage that has been done under Trump. And it's like, but it's to the extent like putting a Band-Aid to once again temporary fixing what was never really properly implemented. And just to remind everyone, DACA happened because the DREAM Act was never passed. And the DREAM Act was going to provide a pathway to legal residency. And with DACA, we had to settle with a work permit and yes, protection of deportation, but it doesn't provide any legal residency. And what happened was that this new administration came and ripped it apart so easily because, again, it's not a law. It was just an executive order. So we went from, and one of the damages that came with Trump was that we went from having to pay $495 every year and a half for this renewal of a permit to now having to pay every 8 months because they cut it down to 1 year. And so reinstating would be a start, but it's far from enough. Immigration reformers, we want a legislative reform. We want Congress. We need Congress to make this happen. So we need to look into like the line items, looking at the past 4 years of executive actions that were damaging to see what's in Biden's control to change. The president-elect needs to look at the damage to understand it is not an easy fix to restore the negative that's been done on immigration cases on the community. So reversing some of the executive actions that were done under Trump, for example, those that didn't get to apply for DACA, those that were left out because it's not expansive, TPS, the travel ban, the pandemic delaying applications, the MPP program, which is not the Masters of Public Policy, but the Migrant Protection Program, which is also known as Remain in Mexico for non-Mexican asylum seekers that are waiting for their immigration court date, asylum denials that are now in immigration proceedings or have been deported, and the public charge ruling that further reduces the number of people eligible to adjust their status. Of course, the list goes on. So stopping deportation for 100 days does not encompass what needs to change, what needs to be changed. In reality, we don't know what it's going to look like, and we don't know what will be prioritized because at the end of the day, the real change has to come from Congress, and we're still waiting to see what happens with the Senate. So it's one of those where like it's still up in the air, and if anything, it's more of a healing process, trying to unravel what, again, all the constant policies that attacked this community to try and further help us grow together in a sense.
Thank you. Professor Ramakrishnan, I see you unmuted yourself. I thought you might have something to add.
I do have some things to add, and I will take this opportunity, being a good academic, to talk about this book that we just released called Citizenship Reimagined. And part of what we do in that book, and it builds on this prior work that I've done on immigration federalism, is for us to recognize, I mean, we always have this dynamic, and this happened especially after 2012, that we think that if you have a Democrat in the White House, that all of the solutions are going to come from the national level. What Lorena, all the things she cataloged are absolutely essential, especially in terms of executive action and reversing many of these things and providing affirmative relief in a lot of ways. But on top of that, there's so much work that can and should happen at the state level and at the local level. If you actually recall, many of the things that California did, what we argue in the book is that California has created a form of state citizenship. It's not the same as national citizenship, but many of the policies that were passed in the Obama era. Let's not forget that even if you have a Democrat in the White House, they are in charge of the enforcement machinery of immigration, including many of the policies. And it's not just the president that calls the shots, right? So you have the Border Patrol Union that is quite strong. And there's all sorts of bureaucratic politics that take place, which lead to some pretty horrendous outcomes, even among presidents that want to do right on immigration and immigrant integration. So I'll just strongly encourage anyone who cares about immigration to do the both and. So it's not either national or state, but to continue pushing for reforms at the national level, but also to keep putting the pedal at the state level. Because even ultimately, if we're talking about, some legislation that passes the Senate, we need to have enough policy movement and political will being built, at the very least, among 50 senators, if the Democratic Party is going to be bold enough to do away with the filibuster on something like that. But 60 senators, right? And unfortunately, in the past, the kinds of compromises that they've had to make on national policy have had some pretty horrible enforcement mechanisms put in the name of reform. Final thing is, I think we are at a stage where we can probably talk about incremental steps on legislation rather than comprehensive immigration reform. So something like a DREAM Act type legislation, I think will probably pass this time around, because I think a lot of progressives and pro-immigrant advocates realize that holding out for comprehensive will mean yet another decade of delay.
Thank you both so much. Again, something else that I think we can circle back to during the Q&A. Pivoting now to issues of economic inequality. Touched on this sort of but more distantly through our discussions of COVID-19 and the economic impacts, but sort of tackling this head on, because again, this was another big sort of hot button issue during the election, particularly the Democratic primaries. So I want to direct this to Professor Brady. Economic inequality, again, frequent talking point during the Democratic primaries. Many Democratic voters feared sort of President-elect Biden would not do enough to tackle the issue. And he's since unveiled his tax plan, which includes raising the corporate tax rate, providing tax cuts to working families, tax credits for things like childcare, elder care, purchasing your first home. In your reading, do you think that the Biden-Harris administration's policies will reduce income inequality? And what are your thoughts on the efficacy of alternative policies that have been batted around, like universal basic income?
Yeah, I mean, I think a lot of us are basically echoing the sentiment that Lorena captured really nicely, which is that we have to think about things that can get done without Congress, because you're not going to get, I'm encouraged to hear Karthick's take on immigration reform maybe getting through. That's great news. But so we have to think about what can the Biden-Harris administration do that without Congress, basically. And I think this is pretty interesting. I mean, one way you can look at it is to say, universal basic income was on nobody's radar until Andrew Yang brought it on there. And you have to give the guy some credit for really setting the national debate. One thing that I think is kind of interesting about this crisis is it gives us an opportunity to experiment with something like universal basic income because of the nature of the crisis. And I think it'll show that it can be a really good policy. I don't believe in universal basic income as a way to substitute for all our other social policies, but I do believe in it as a supplement to our existing social policies. So it is a good idea. And one historical example I'd give would be that during the 2008 crisis, we actually saw a decline in deep and extreme poverty in America during the worst recession we've had since the Great Depression. And the reason was because we massively expanded food stamps, or SNAP, or what we call CalFresh here. So we can use these sorts of programs basically to alleviate a lot of poverty under the pretense of the crisis, and we should do so during this time. Beyond that, I'd point to sort of two issues. One is that, as these comments have indicated, a lot of what we can do is going to occur through the tax system. There's a nice book by Josh McCaig about the fiscalization of social policy. And the reality is that's basically what we're going to do to fight poverty these days: expand the EITC, expand the child tax credit. I can't believe I would give credit to President Trump's tax plan, but it actually did provide some tax relief for low-income folks. And the expansion of the child tax credit actually did transfer resources to low-income folks. Beyond that, I would sort of underline the role of organized labor, and this is too often neglected. It's particularly crucial, and it's good that the Trump administration is going to be gone, hopefully, we don't have a coup, and the Biden administration can install a more reasonable National Labor Relations Board such that we have the governance of labor unions. It was a huge failure of the Obama administration to not fight for organized labor, even though they had promised to do so. They completely dropped the ball on that. And let's hope that President Biden recognizes the important role of organized labor, because that's one of our best tools to fight income inequality, to fight poverty, what have you. And I would just even go so far as to say, there's no way you make any progress on income inequality or poverty without organized labor. So I hope the Biden administration pays close attention to that.
In the interest of time, we're going to move to the next topic again without having a full panel response, but I think, again, this is something that will likely come up during the Q&A based on what I'm seeing so far. I'd like to transition now to looking more at state policy and regional impacts. We've talked a lot about, obviously the impact of the new incoming presidential administration. But I want to start with sort of this weird puzzle and conundrum that we find ourselves in. Prop 16 and sort of the referenda that pushed trying to allow, again, some considerations for race and gender and other characteristics in hiring. So Professor Ramakrishnan, I'm going to put this to you in 2 minutes. California voters overwhelmingly supported a presidential candidate who promoted diversity in their appointments, and President-elect Biden went so far as to announce, before picking his VP, that he only wanted to consider women for the position. But in that same election where California backed Biden, they voted against Prop 16, which would have reinstated the state's ability to consider characteristics like race and gender in university admissions and hiring practices if it was one of many factors. So my question to you is what do you make of this divide, and what does it tell us about the state of identity politics or politics more generally in California?
Yeah, I mean, if you look at the ballot propositions this year, it was a bit of a mixed bag. And before I get to Prop 16, I mean, there's a kind of particular story there that I think is important context. If you look at criminal justice, so one of the things is that many voters might not have been making the connection between their support for racial justice, which most of the protest was about racial justice in the context of law enforcement and criminal justice, right? That's what most of the protests were about. So when you were saying Black Lives Matter, people were thinking about that in terms of life and death encounters with law enforcement. They were not thinking about it in the context of college admissions or contracting, public contracting, right? I mean, those connections can be made, but there wasn't enough time to make those connections. How did this come about? This came about through a constitutional amendment that was initiated by the legislature. Contrasted with other ballot propositions, including Prop 15, which is much closer, that's been based on years of public education, building coalitions, getting labor unions engaged and involved, and this kind of process, this kind of organic process of community organizing to get it there. I think many thought that given the priority to racial equity and racial justice this year, that something like Prop 16 would easily make it over the top. But for ballot propositions, one of the kind of truisms in California politics is that unless an issue is very well known in the population, and we need to remember that for almost 25 years now, Californians have not had experience with affirmative action. So when you're talking about Latinx and Asian American voters, most of those are new voters. I remember as a student at UCR about a decade ago, I was teaching a class on California politics. I mentioned affirmative action, and she asked me, "What is affirmative action?" Right? It's just been absent from our discourse. So it's going to take a lot of, I think its failure now might indeed bring it back on the agenda. But what we saw in terms of pre-election polling, a lot of uncertainty among Asian American voters and splits among Latino voters. The language is a bit confusing as well. That said, I think on other propositions, including on voting rights for those on parole and not increasing penalties for those who repeatedly violate their parole or have crimes like being a serial shoplifter, classifying that as a felony, that failed. So I think there is cause for hope when it comes to racial justice, but there's a lot more work to be done.
Thank you for that. So with sort of that backdrop set and that conversation about our issues with propositions in the state of California, I want to turn now to Kristen and look at Props 15 and 21. You're not expected to remember what each was for, but broadly, they grappled with property taxes, funding for schools, and issues of housing, which is obviously Kristen and her center's specialty. So, Kristen, Californians voted on these three propositions related to housing and property taxes. Voters approved a new property tax break in Prop 19, but then they rejected an increase in property taxes in Prop 15 and voted against rent control and Prop 21. Can you speak to how these referenda could have impacted our region and what can be done now, or are there other pathways that you see to affordable suburban living?
Sure. So first I want to emphasize, I mentioned this before, but housing is not a vacuum. It relates to transportation, to education, to what jobs you can have. So anything to do with housing is immediately going to be very complicated, especially when you bring property taxes into the mix, because California has had a very long history with property taxes. Proposition 13, has been in place for, I think, almost 40 years or over 40 years. So with that in mind, California did reject Proposition 15, which would have raised taxes on commercial and industrial properties, and that funding would have gone to local governments and education, the additional funding, I should say. And again, Proposition 13, it's really the third rail of California politics. And people really do not like property tax being raised. And I think that's due part to the indirect cost to the consumers. If you raise taxes on commercial properties, let's say a store, for example, that store is going to have to charge more for its products. The consumer and the residents are going to have to pay more for the products. So there's actually a lot of indirect costs with raising certain types of property taxes. And the additional funding for education would have been great from this proposition. It would have helped with COVID era education, the digital divide, which really disproportionately affects people of lower incomes or minorities. So that would have been a great effect of this proposition. Proposition 19 did pass, so that's good, I guess, if you are into that. It would have allowed homeowners over 55, those that are disabled or victims of wildfires, to transfer their property tax base to a new residence. And it also establishes the Fire Protection Services Fund. And so this is going to be great for the further portions of our county, places like Lake Arrowhead, places like Coachella Valley that are really susceptible to wildfires, and that those residents might not have the money to move elsewhere. This establishes the fund and also lets them transfer their tax base, which is good. Proposition 21, which was not passed, would have allowed local governments to establish rent control on properties over 15 years old. And this would have been great for people, again, on a fixed income, possibly for students, but the academic research on the effectiveness of rent control is actually kind of varied. And a lot of research has shown that it actually takes more units off of the market, leading to higher prices in the long run. So, and it's not surprising that it did not pass. 2 years ago in the midterms, Proposition 10 was very similar, and they were both propositions were beat by about a 20% margin, a 20-point margin, so it's not surprising. The good news, the silver lining, is that AB 1482, which was passed in, I think, 2019, has a lot of tenant protections in it. So in terms of other pathways for the region, I would say we have to focus on balance. We have to bring more jobs to the region. We have to increase the supply of housing. We have to build more housing. So it's very, very complex, and there's a lot of facets with the economy, with transportation, with education, et cetera, et cetera.
Thank you, Kristen. And with that, we're going to wrap the structured portion of today's panel and move on to audience Q&A. So if you haven't already submitted your question, if you had one throughout, or something that you would like us to maybe expand upon, please use that Q&A function down at the bottom of your screen. We do have quite a few that'll get us probably more than take us to the end, but but pile your questions on there, and we'll do our best to get to them. So I want to start by going back to really what we started with, which was COVID-19 pandemic. And I think these two questions probably are best suited to be at least initially addressed by Professor Carpiano, but we welcome everybody's perspective here. There was a question about how can we counter major anti-science or anti-vax voices, particularly on social media, both in policy, but also socially. And there also was a request for you to speak a bit more on the Pfizer vaccine and notions of should it be free, and how can we look at distribution in order to be more most effective.
Well, how much time do we have?
I know.
We could do a whole panel on those two questions. Okay. Yeah. All right. So let me see how succinctly I can handle this. So the first thing is, as I've been saying for months now, actually, public health needs to be getting much more into the 21st century game. About misinformation is sort of the new public health problem, and unfortunately, again, public health is very underfunded in a way to effectively deal with it. I think going forward, it's going to require a culture change. We're starting to see that at least already, and I'm heartened by that with the new administration coming forward and really putting this emphasis about science and making sort of a change around that. But in addition, with just thinking about some basic sorts of ideas addressing this, given the time frame here. And one of the big things I think is going to have to be around having more focused sorts of discussions and partnerships with the social media industry. I really think that we've really had we've really kind of relied on these companies to be socially responsible, have some sort of sense of corporate responsibility, and hope and pray that they're going to do the best thing. Instagram, for example, took some leadership on this a while back. Facebook seems to be sort of still the laggard, or sort of at least an incomplete actor, you could say, in sort of addressing and dealing with misinformation online. And so I really do think it's going to require some sort of government private partnership and sort of discussion to be able to work through things. If not, I mean, it's going to be a bit tricky to think about how we might be able to regulate and bring in legislation in terms of those. In terms of that sector. But I'm at least heartened by the fact that there have been companies that have been trying to at least to try to take on the issue of misinformation, as Twitter has been showing too with that. When it comes down, though, also for misinformation, as well as I would say just sort of communication to promote uptake around an eventual vaccine, knock on wood, really, of course, there's going to be the issues of equitable distribution. Already there is a National Academy's panel that was convened on that. And put together a report that I really do hope that Operation Warp Speed takes into account in thinking about equitable distribution, particularly among vulnerable groups. But it's not going to be enough just to be able to do outreach and do education campaigns and things of that nature. We're really going to have to be doing outreach on a local level to local leaders in order to be. I mean, we have a number of communities that have been historically disadvantaged, certainly understandably distrustful of the medical care system, of the science community. The shadow of Tuskegee is a long one, and it still exists. For example, we've had ICE raids, so the idea that that of government coming along and distributing vaccines. I mean, certainly it's going to have some issues there, as well as just general sort of healthcare access too, and thinking about and thinking through those sorts of plans. So those are going to be some sort of tangible ways, just some quick bullet points on ways to address that. But it is going to overall require a very much a multi-sector type of approach to dealing with misinformation, promoting campaigns like mask wearing, for example. Businesses forcing people to wear them, I think, has actually been a good thing in the sense of normalizing them and making it something where it's not just about government and public. Public health is government, and so naturally, when public health does things, it automatically looks like government overreach to many. So when businesses start to put in rules, and we can see lots of normalizing around this and making it a lot easier for the job to get done. So, like as I said, so to summarize, I just think it's going to require thinking not just about things that the public health agencies can do, but how it's going to require really a multi-sectoral type of approach to be dealing with disinformation, misinformation, and to ensure uptake of recommended interventions and strategies.
So 4 minutes. You covered a lot of ground in 4 minutes, Professor Carpiano. That's great.
I went that long?
No. Well, no. I mean, as you said, how much time did we have? No, that was great. I want to pivot back toward immigration. I know this was an area that sort of we promised that we would have a discussion during the Q&A. And we have a question from the audience asking, can we expect a reversal or easing of rules regarding study and work visas for international students? What do our experts on this panel think?
Well, I guess I'm hopeful because I don't think we could have a worse administration for visas and immigration restrictions than we had up until now. So I'm hopeful it can't get worse, but maybe that's naive. I'm not sure.
I mean, that is under the power of the executive, but Lorena, I wonder if you have any thoughts on that.
No, yeah, I mean, it's one of those where I don't think it can get any worse. We're expecting a little bit more of a positive light on changes with immigration, but we don't necessarily know to what extent that they're actually going to go.
Of course. Next question deals with Proposition 25, which was rejected. It was going to replace the state's cash bail system with risk assessments. Question being probably to Professor Brady, sort of how does this speak to the issue of the criminalization of poverty? And how might Prop 25 have taken steps to decriminalize it? Assuming you'll be the one to answer this, but if somebody else wants to take the wheel, they're more than welcome to.
Yeah, I mean, it would have been good had Prop 25 passed. It was a weird proposition that you had to vote yes to keep the current thing that the Senate had passed. So it was a really kind of a weird framing. I do think it would have been good. I mean, any easing of mass incarceration is a good thing. And we're making baby steps away from this mass incarceration model. I don't think that it would have made there's so much more that needs to be done to get anywhere near racial equity in criminal justice. This is just a drop in the bucket, but I do think it would have been good.
Professor Ramakrishnan, maybe you can jump in there. Obviously, criminal justice reform was on the ballot in California and didn't, it was a good.
Yeah, this was part of the thing, talking to advocates, first of all, even the legislation involved some compromises that not everyone was thrilled with. But yeah, this was a referendum, right? So this was the kind of thing, in certain circumstances, the research on ballot proposition shows that money doesn't rule everything, but it definitely helps. And especially to raise skepticism. One of the things we saw, and this was just so cynical on things like Prop 22, on Prop 15, I'm not so sure as much on Prop 25, you had well-paid advertisements. So for example, Prop 22, all these people of color talking about how great this was. It was just extremely effective in terms of casting an impression that communities of color were like overwhelmingly in favor of Prop 22 when it wasn't clear. They also essentially bought for the app-based systems. They essentially, I should be careful in the claims that I make, but there was the state NAACP came out in favor of that. There were some big questions in terms of the kinds of financial conflicts of interest involved for the head of the state NAACP to come out in favor of Prop 22. So it's more generally, I think, we know the proposition system has to be reformed, but there's a lot of room, I think, for misinformation and voter confusion to rule the day. Final thing I'll say, in terms of immigration, is that we should be careful. I think there's still some constraints, especially in an economic downturn, that a Biden administration will face. It's similar to what President Obama faced in 2008. So I think there are certain kinds of relief that are in the offing. But I think on other aspects of it, I think it'll be tough. One final thing I'll say. This notion that by closing off the border is how you achieve our public health outcomes is like so ludicrous. It's not about closing the border. It's actually following common sense, public health protocols. So I'm hopeful that we will actually, for a school of public policy, I remember when we had this kind of a conversation after the last election, one of our faculty members said that they still retain hope that evidence will matter in terms of policymaking and decision-making. I am really, really hopeful, because when it's life and death, you do not have room for error. And we've been making errors left and right. And I'm really hopeful that we don't repeat those mistakes.
Can I follow up? I think I might have been the one to say that. I'm not sure, but I don't have any hope left, Karthik. Maybe I did in 2016, but I'm not sure any evidence is going to shape these things. I maybe believe these days just in power. I don't believe in science or evidence prevailing. Anyway, I was just going to mention that there were some possibly good signs of this election on criminal justice and racial equity, and that was the election of George Gaston as the LA County District Attorney and the loss of Jackie Lacey. And so this was clearly where police reform was on the ballot. And it was good to see LA voters push to change a very punitive district attorney with a district attorney that has at least spoken in a very admirable way about having to address this. And I'd add that the city councils and county board of supervisors are under a lot of political pressure to put pressure on these police departments. So like in Los Angeles, the sheriff's county, the LA County Sheriff's Department is under enormous political pressure, as they should be, because it's an incredibly corrupt and brutal regime. And so I'm a little bit hopeful that the pressure on city councils and county board of supervisors is going to put pressure on police departments, and the district attorney's race is one good sign in that regard.
So a different direction from one of the attendees, looking at a more regional approach, potentially sort of having a regional quasi-CARES Act funding. They're posing, if both counties were to tax ourselves to keep providing funding for if both counties were to tax ourselves to keep providing funding for CARES Act, has this been studied? Is this possible? What would be sort of drawbacks or hurdles to doing this?
I mean, I saw that question. It's a good question, but I'm a little skeptical that would work because there's just not enough money. The states and the counties are all broke, basically. And so, taxation, I tend to be in favor of almost always, but I tend to think the money's going to have to come from the federal government because the states and the counties are broke. Yeah, and similarly related to this, there's another question about, these efforts to basically enforce the possibility of higher property taxes. All of those ballot initiatives, like Kristen said, Prop 13 is this third rail. And unfortunately, all of those propositions, the politics went exactly the wrong way for revenue. So I'm actually opposed to Proposition 19. I think that was a terrible proposition because even though, sure, there's some wildfire relief, it overwhelmingly was an initiative pushed by the realtors. Basically, it was the National Realtors Association that pushed for it because they just want to create more customers in the housing market. And that's not going to be egalitarian or progressive. We're going to lose money because of it. So I just am a little bit pessimistic about local and state taxes as being the real money source.
I want to follow up, or does anybody want to speak to what Professor Brady just said, or can we jump to the next?
I'm just marveling at the cat in the window.
Oh, this is my cat, Helena. She's actually a Riverside native. I got her off the streets this summer. So she's, her name's Helena Milk.
Yeah, no, it's been great to watch.
Yeah, events during COVID, right? We're all of a sudden eating each other's homes, which is
Absolutely
fun, very different. Before we get to some of the questions that are more political in nature with respect to, if President-elect Biden will be likely to use executive orders, if so, what for? I want to follow up just really quickly on something that Professor Carpiano mentioned, and I think has been a big concern of many Americans, which is sort of at what point in your opinion as a public health expert, would it be appropriate to trigger some sort of a lockdown again? Or do we not need to go that far?
Yeah, that's a good question, and that's a very tough one. And it really does nicely highlight the fact of sometimes that science is, science can only get you so far sometimes in terms of making policy. That there's really some, it's certain things where you really got to go with instinct and best sort of ideas on things. Certain states, we're starting to see sort of the move towards it. I don't think we're necessarily sort of there yet with in terms of California, but we can see certainly we're on the path to doing that. It's going to be my concern with this is. Obviously, case is first and foremost, but the degree to which a lockdown now, as we saw months ago, is really going to be received at this point now with much sort of sacrifice everybody's been dealing with too. And so we really do have to be thinking about some different sorts of unintended consequences. I don't want to get into the rhetoric or things, which is, and this is going to sound cynical, maybe a little sarcastic, but the comments about mental health problems and things like that by policymakers who you never heard those discussions and concern about those public health issues before this, just because really it's really sort of a Trojan horse way for them to be talking about opening up in terms of the economy. But to the extent to which we have a full lockdown, I mean, it's going to have to come with, as David was talking about earlier, it's going to have to be coming with some serious funding with it. Otherwise, the rest of which the population's been all Americans really been dealing with this now. Has really been severe, and so government really does need to be coming to rescue if that is the path that we really do have that we have to take with to address numbers, and like in Wisconsin, ICU beds being all used.
Yeah, the quick thing I want to say about whatever version of quarantine, lockdown, shelter in place, et cetera, this should not be a partisan issue. So you had, I believe it was in the Minneapolis Fed, Neil Kashkari, Republican, former candidate, Republican candidate for governor in California, saying that we never did the first lockdown correctly the way other countries had. Now, of course, other countries, including in Europe, are facing those issues. But, I know that some people may roll their eyes when we want to refer to Canada as an example. People think of Canada as exceptional in so many ways, but I think it is worth looking at Canadian provinces, what they've been able to achieve, and also the Canadian government nationally. And that's what happens when you have it's not like Canada doesn't have conservatives. They have a lot of conservatives, but essentially you have a population that generally believes in science and follows rules when it is deemed in the public interest. And I'm hoping it's going to be hard. And this is where some of the stuff we're talking about. So it's not just social media, right, Rich? I mean, it's the growth of particular kinds of virtual communities, including QAnon, and you even conservative talk radio. It's about it's lower tech than what are the more sophisticated ways of organizing you see today. But I think what the pandemic has exposed is, generally speaking, we as a society. And as a democracy, you may be fine with having a kind of fringe element that is rife with conspiratorial thinking at about 10% or 20% of the population. But now we're talking about some of these ideas that are well above 20%. That really makes, I think, many of us concerned about public health and just the health of our democracy in a more fundamental way. If we are not seeing the same realities, I know this is maybe going a little bit afield, but if we start to get to some of these root causes, recent survey from YouGov, 86% of Trump's voters think that there was significant election fraud that needs to be investigated, despite no evidence so far produced that indicates as such. So it makes me concerned that even if we're well into 2021, both in terms of our public health and the health of our democracy, there's some serious areas of concern that'll require investments of various sorts. And I really am hoping that we can all agree on the same set of facts, even if we don't have the same opinions.
Yeah, and I was going if there's time, just to add in. I mean, and Karthik hits on a really important point. What COVID has really revealed to us is at the outset of this, just from just a simple standpoint about the anti-vaccine movement, people were arguing. I admit maybe I was a bit naive about this too, thinking, well, here comes a pandemic. This will push back against that, and this will really in a sense, unfortunately, went over hearts and minds about how important that public health really is, and and science disinformation. What we've seen over the past few months has really been the anti-vaccine movement really evolving and joining in with very strange bedfellows, including some very fringe types of anti-government groups, where it's really QAnon type thinking, other types of conspiracy thinking, science denialism more broadly, anti-government, and so therefore anti-public health. Is really just, it all just comes together in one big gigantic monster. And so really we do see how now the really intersections of politics and public health in ways that are really quite dangerous.
I wanted to sort of build on that and redirect this question to Lorena and to Kristen, sort of as our designated young people on the panel, insofar as there needs to be some sort of a coordinated, I don't even know if an awareness or an educational campaign would suffice here, but let's pretend like it would. Sort of what, obviously, the way that you reach younger voters is very different than the way that you reach established, older voters. So is this also an area where you think that sort of, I guess, what would your recommendation be? I'm kind of speaking in circles here, but as a younger person who's more, using newer forms of media, what's the way to sort of, educate in this area, in your opinion?
It's actually really funny. I was listening to a podcast and they were talking about how they voted specifically because it was a TikTok trend. And I and I thought that was hysterical. It's when you say things, because of all the new media, things are changing so rapidly. The way to educate younger people, I know that's been a bad word in this panel discussion recently, but the way to educate younger people is definitely changing. So I'm not sure I have any recommendations, but I can definitely echo that the way to reach young voters is ever changing.
So it's getting Fauci on TikTok is then what you're advocating?
I guess so. And the thing about the internet additionally is that you can find your echo chamber. So as much as you see people on TikTok or Instagram or Facebook educating people and trying to get science-based evidence out there, there's additionally a whole other host of people on the platform that are distributing non-science or their beliefs, etc. I don't know if that answers your question, but
it's some insight. TikTok voting.
Yeah.
Lorena, did you have anything?
As ridiculous as it sounds, honestly, I'm pretty sure there's more viewers on TikTok than on CNN, especially within the younger crowd. So it's one of those where I share as far as like my siblings, they were eligible to vote and they did vote, but they actually were interested because of the memes and again, TikTok, that's what made it entertaining and actually gained their interest to actually partake in voting and also kind of like what's out there information. They learned about AOC through memes. It's just one of those where it's definitely changing. It's no longer necessarily just those that are just attending, pursuing a higher education, or again, just what's on the news media, but what's on social media. And it is a double-edged sword. There's a good and the bad, because there's a lot of false information, and then also, of course, like those bots that are just putting in comments that are not necessarily facts or actual legit to what is being posted there. So
one thing I'll just quickly clarify in terms of my comments about social media was in no way talking about youth. Actually, I actually think youth are much more savvier consumers of social media, including understanding the difference between misinformation and accurate information. It's the older people that I worry about, right? It's the equivalent of when old people discovered email and would just spam forward all sorts of stuff. We have the social media equivalent of that now. And I worry about, it's much more about Facebook. Now we're talking about Parlay and the kinds of rhetoric that is being cooked up in Parlay. Some of it is quite scary.
Yeah, if I could add, if I'm not, Karthick, correct me if I'm wrong, but it is the case, right, that youth turnout actually did go up this election for it's this political
As far as
science.
we can tell, yeah, we'll know the
Yeah.
numbers soon, but yes, absolutely. It
Yeah.
looks like it
It's,
is.
it's like a political science meme, if you will, that like we always keep being told this election young people will vote, and every election they don't, and every election it gets worse and worse. But finally, this election, so we basically need an existential crisis to our democracy to get young people to vote. So I'm glad they did. It seemed to have swayed it, especially in some border states or some boundary states.
Yeah, and the TikTok trend was actually really big, and I wonder how that specifically affected voter turnout, because it was a huge trend, millions of videos.
Certainly. So last question that we're going to pose to all of you, because we are wrapping up. What policies do you expect, or what policy maybe would you like to see President-elect Biden to attack most aggressively and immediately via an executive order, even if the Senate is, 50-50 split? Anybody want to?
I've got one. I mean, I don't know if this is real, but you have Charles Schumer, of all people, talking about how the Biden administration is sincerely considering canceling student debt up to $50,000. And I don't know if this is really going to happen, but that would be extraordinary. And basically what we'd be doing is we basically privatized higher education in the past 30 to 40 years in a way that would have never been imaginable. And basically we're retroactively socializing that. And it's by no means the most efficient way to solve this problem, but it certainly would help. And so I think that given especially the racial disparities and economic disparities in who carries student loan debt, this would be a good move, even if it's not like the only way or a complete solution. So if they do this, I'd stand up and applaud.
So I would just channeling what Lorena said on immigration. There's so many things that can provide immediate relief. On top of that, there's talk when it comes to making progress on climate change, so rejoining the Paris Accords, and with the federal government itself and its operations, making sure that it's a greener operation. I think that's going to be critical. There's so many existential threats to our democracy, to our health, but the ones to our planet are so important. And I'm hopeful that we can buy ourselves a few more years of time before things go really haywire.
Rejoining the World Health Organization. It's going to be, this is, if anything, the pandemic's shown us how we're all tied in with the rest of the world. That, and I would also argue, we also need to be starting to consider how exactly the oversight and independence of the Centers for Disease Control and even the FDA operate. There have been some very nicely done arguments about how those can be restructured to be more independent and less. Obviously, they need oversight, as they should as government organizations, but being able to be more free to operate as the independent science authorities that they are, versus being susceptible to meddling as we've seen in the past few months.
If we have time, I was curious, I know there's a lot they could do in terms of immigration, but I was just curious, sincerely, to be educated by Lorena and Karthick, what would be some really specific concrete things they could do? Because I know there's a basket of them. What would be the best ones?
In like 60 seconds.
Well, let's go to Lorena. I mean, she had a big wish list. If there's 2 or 3 things, Lorena, what would it be?
Well, I mean, I know there's always a lot of focus on DACA, right? But realistically, yes, I do think Biden can reverse that and bring back DACA to what it was under the Obama administration. But furthermore than just DACA, like advanced parole, which I think a lot of students were not aware, or a lot of DACA recipients were not aware that advanced parole existed. And for those that don't know, advanced parole gave permission to leave the country and enter back into the United States lawfully, which brings in like a big benefit when it comes later down the road when they're trying to apply for a different immigration relief. And back under Obama's administration, there was 3 reasons that you were allowed to ask or seek for advanced parole, and that was humanitarian, educational, and occupational. Right now, yes, we have COVID-19, but how great would it be to allow for undocumented students that are attending UCR to partake in study abroad programs? That was something that I was able to do as an undergrad at Cal State San Bernardino, again, a different administration at the time. So that would be something that I look forward to bringing back, at least is more on the advanced parole aspect.
So the quick thing I'll say, and we will now, unfortunately, because Congress is so divided and has essentially handed over power to the president It's not just under President Trump, but also you saw that under President Obama. We have become more aware of the difference between executive actions and executive orders and rulemaking in the federal bureaucracy. Some of these rulemaking, like the public charge rule, will take another rulemaking process to change that rule. Some of the things like the Trump administration suing the state of California on its Clean Air Act waiver, Biden administration is probably going to drop that, right? So there are important tools. It will make an enormous difference. But if you're talking about legislation, that's going to be a really, really high bar to clear. And that's unfortunate. We are essentially doing policymaking through executive action, for the past 7 or 8 years now.
Great. Well, thank you all so much. Clearly a lot of work to do. Thank you to everybody who attended. It's obviously all the time that we have for questions. Thank you for staying with us. If you're still on the clock, that extra 2 minutes. We hope that you'll join us in the future for more School of Public Policy events. Next Thursday, we actually have a COVID-19 panel with experts from across the University of California system. So if you didn't get enough of that today, please join us then, and you can learn more about that event and all of our events by visiting spp.ucr.edu. Thanks so much. Have a great day.